African leaders are pushing for self-sufficiency in vaccine production to address the present issue of vaccine inequality on the continent. This move was emphasized at the Equitable Access to COVID-19 Vaccines in African Conference in Abuja, which brought together stakeholders to discuss the disparities in vaccine access, availability, and manufacturing in Africa. Our correspondent, Annie Anthony, reports.
Provide a platform for the dissemination of research findings, exchange of ideas, and networking opportunities to inform better vaccine policies in African countries. The conference, according to Grace Njeri, Executive Secretary of the African Health Economics and Policy Association, also sought to provide an avenue for stakeholders to become change advocates in their respective countries and push for evidence-based vaccine policies.
And also there's need for the public sector to work with the private sector, because we also witnessed that access was high among the private facilities compared to the public facilities, and it was also higher among the high-income earners compared to low-income earners. So there's need for all sectors and all stakeholders to come together to ensure that those who are left behind in terms of access to vaccines and in terms of access to health services broadly are able to access the services that they need.
Jane Karanga, representative of the United Nations Economic Commission for Africa, emphasized the need for Africa to improve its vaccine manufacturing capabilities, leveraging the African Continental Free Trade Area. She noted that local vaccine production would enable the continent to reach more people, creating a healthy and productive population that can participate in the economy and transform it.
60% of our population is youth. We need to create jobs for them. We can plug into the value chains, regional and global value chains in pharmaceuticals, because it needs a lot of the activities, whether it's starting from your research, the full ecosystem, starting from research, starting from education, technical skills that is needed, distribution, logistics, among others. So we can plug into that regional value chains. We can transform our economies. Then, of course, the Africa we want, leaving no one behind, will be realized once we produce on the continent.
Ogechukwu Emmanuel, representative of the Vice Chancellor of Veritas University, Abuja, highlighted the disparity in vaccine access, availability, and manufacturing in Africa.
Credible vaccine access, so that when we need such vaccines, such commodities, life-saving commodities, they are available to our people. That is number one lesson, that Nigeria should move quickly to manufacture vaccines in country.
The stakeholders believe that by building local capacity to manufacture vaccines, African countries can ensure timely access to life-saving commodities during emergencies and epidemics, reduce its reliance on external sources, and create a healthier and more productive population. Ene Anthony, STV News, Abuja.